Welcome to the PSW webinar entitled Pharmacists and Public Health, Prevention, Preparedness, and Partnerships. My name is Randy Braun, and I am a fourth-year pharmacy student at UW-Madison School of Pharmacy, completing an advanced practice pharmacy experience with PSW. Before we begin the educational program, I would like to point out that this webinar is approved for 0.75 hours of continuing pharmacy education credit. Please follow the instructions on the webpage to take the post-webinar self-assessment quiz and claim your CE credit. At this time, I would like to introduce the speaker for this webinar, Dr. Patrick Rose. Dr. Rose is the Director of Pandemic and Catastrophic Preparedness at the National Association for County and City Health Officials. He holds a PhD in microbiology and immunology and is a subject matter expert on national security issues related to chemical, biological, radiological, and nuclear weapons of mass destruction. He has worked domestically and internationally with efforts in developing response operations to crises resulting from public health and terrorism incidents and training national IMAT teams. In 2011, he was recognized as one of the top 100 international academics worldwide by the German Scholars Organization and the President of Germany for his work in arthropod-borne infectious diseases. Thank you, Dr. Rose, for providing this webinar. At this point, I will turn the presentation over to you.
Randy, thank you so much, and I really enjoy the opportunity to talk to you today about how pharmacies play an enormously important role in prevention, preparedness, and responding to disasters, and catastrophic disasters in particular. And hopefully during this presentation, I will be able to make this point as to how you play a very vital role in us being able to have a whole of community response strategy effectively serving our communities in a time of need. To start off, I would like to give a little brief overview of what the National Association of County and City Health Officials is, and what our mission is, and what we're trying to accomplish. So the National Association of County and City Health Officials represents the roughly 2,800 local health departments and 162,000 employees that surround those health departments. And what we basically do, our mission is to really be a leader and a catalyst, as well as a voice for our members, the local health departments, to make sure that their concerns and priorities are met, and also make sure that we can help them in building a sustainable and resilient community when it comes to dealing with public health disasters. And so in order for us to do that, we work very hard and diligently to promote health and equity to combat disease and improve the quality and length of all lives. And we only can accomplish that through a whole of community approach, which you'll see as a recurring theme throughout my presentation. So how do we accomplish this? Well, NACCHO takes a lead in public health security. And what we do is, because we work across the nation with our local health departments, we understand what the needs are through discovery and evaluation of the gaps and issues and challenges that our local health departments and their communities are facing. And what we do then is, in coordination with federal agencies such as the Centers for Disease Control and Prevention, the Department of Homeland Security, and others, is that we identify strategies and implementation plans as to how to best address those issues. And not only develop some kind of a guidance, but then go out and test and pilot these strategies so that they're implementable and easily useful to the communities, because we understand and recognize that a lot of the communities are resource constrained, suffering from a lack of funding or a lack of staffing to be able to deal with these catastrophic scenarios that we're talking about, whether we're talking about a chemical disaster, a biological disaster, or a radiation emergency. And it's that key piece that is extremely important, because unless we're able to implement those strategies that we put forward in coordination with the federal agencies to the communities, then it will not be as effective as it should be. And so building on that, then once we've identified best practices and lessons learned either through the local health departments having used those systems or us coming up with the best practices, we go and develop a community of practice by taking those experiences and sharing them across the country with other local health departments so they can adapt it to their own systems and their own communities. And the intent there ultimately is to provide a national implementation plan. And that a national implementation plan then feeds into, again, new discoveries and evaluations because unfortunately in this business, we're never satisfied and new threats continue to emerge. I think there are plenty of examples this year alone of things that have come to mind and surprised us, whether we're talking about the Ebola epidemic and how that affected our national imagination in terms of what the threat is from overseas, to unexpected instances like the DoD anthrax shipping errors that happened and how those might affect our communities as a whole. So NACCHO has a huge role to play there, and we see ourselves as the voice again of the local health departments, but also in the leadership role to be a catalyst for them. And in doing so, we're not just talking about it, but we also have a toolkit that we develop to be able to provide resources to our members and their communities so that when they build out the partnerships, they can be more effective at it. And that may include reports in terms of what we've learned throughout our communities, as I mentioned, through best practices learned, or by doing research and analysis surveys with our local health departments and trying to understand what the needs are and what the best approaches are. It might include policy guidance and documentation like this one illustrated here that we've developed with the Centers for Disease Control. And lastly, what we also do is that implementation piece. So here are a couple of my staff member out and doing an exercise, and you'll see a bunch of these pictures covered in throughout the presentation of a recent exercise that we conducted at a pharmacy in Utah, Salt Lake City, on mass dispensing of vaccines and antivirals during an influenza pandemic. The last thing in our toolbox that we have are our communication channels. We have an extremely robust communication machine that includes blogs, that includes issue briefs, social media to promote practices for stories in the field, to sharing, to really being a sharing platform that can be used throughout the community, not just for our local health communities, but to our healthcare coalitions, pharmacy community, and emergency management community. It's really an opportunity to be able to share our lessons learned with everybody out there, because otherwise they would not be of use really if we just let them collect dust here on our shelves. So that's an overview of what NACCHO is. Now let's talk about advancing the definition of the first responder. And really when we talk about first responders, you can see that we have the typical pictures here from National Guard, our emergency management agency, at the local level with fire, law enforcement, at the federal level with FEMA, among others. But pharmacists are as much of that first responder definition as any of these other groups are. And it's been a struggle and not necessarily that's in our national mindset as to that pharmacists play that first responder role. And hopefully I'm preaching to the choir on this one as to what role you play, but it's definitely a continued challenge, and we can only behoove you to continue to make that point to your local communities that you are part of that first responder community. And here's why that is, because you share, pharmacists share as much of a mission and responsibility in public health as any other healthcare professionals. Because increasingly you have continued to play an extremely important role in healthcare management of your communities, whether it's through promoting wellness, through helping patients manage their chronic diseases, or offering health screens, providing health education, providing the dispensing of medications, or providing vaccinations. And a lot of those pieces play an and you are a trusted member of the community. And so your community members will look to you first. Your community citizens will look to those trusted members to seek advice, to seek guidance, and to seek help when they need it in their most extreme cases. So the other part to that is that pharmacies have an extremely unique reach that is unlike any other, and that is you're able to reach the most vulnerable populations. So we know for a fact that consumers shop at drug and food retail stores 1.9 times a week, and 90% of those consumers live within 5 miles of a community pharmacy because they go to their pharmacy to meet their daily needs and reach out to you for the various issues that they are struggling with. And that has been illustrated not any more clearly than the recent Baltimore riots. And what you see here is a map of Baltimore City, the inner harbor city, and how the riots affected the community. So the dark red, this is a heat map of the population density, and the dark red is the areas with the highest level of density within Baltimore City. And the dots with the circles are all pharmacies that were affected during the Baltimore riots. And each one of these pharmacies was negatively impacted and closed for a certain time. The ones in green are pharmacies that were able to reopen after the riots ended and cleanup was completed to a certain extent. The ones in red did not. And you can see that a lot of the red ones are in high population density areas. And that's a huge public health emergency because, as you know better than anybody else, you're serving a community that relies on the ability to access your facilities on a daily basis. And so the loss of these pharmacies has had a huge impact on the community. For example, the 62 residents of Penn North Plaza Senior Living Facility were severely impacted by the CVS next door to them closing down. And a lot of them are not mobile. They rely on other people. And so that immediate pharmacy to them is not there anymore. And that affects their daily life. And that, in the worst case, can threaten their daily life if they are have chronic illnesses that they need continued support. And they need to make sure that their medication is current or filled. And so that public health security issue is often not discussed because the cameras are gone after the fires are out and after the madness is over. That recovery part and that is as much still of a response because you're dealing with the community that has been affected. And that's where you play an integral role in public health preparedness. So let me talk to you a little bit. And again, I believe I have been preaching to the choir, so none of this is new to you. But let me talk to you a little bit about how we envision and how we hope to see a continued connection between public health with pharmacies, because we rely heavily on your activities. And the other piece to that is really that you have an infrastructure in place that probably, and I would say most definitely, hasn't been leveraged enough to the point where we need to build out better plans to leverage that infrastructure to respond to various types of disasters. And that begins with synchronizing public health emergency response activities and bringing pharmacists into the community planning pieces of preparing for public health emergencies, whether we're talking about conducting disease surveillance, preparing for worst case scenarios of dealing with surge of a mass casualty following a mass casualty event, or communicating to the public. Like I mentioned, pharmacists are a trusted member of the community, and community members will more likely look to them than someone at an emergency management level, law enforcement level that they don't really know or aren't so sure about. that additional level of trust can save lives and hasn't been leveraged enough to be able to increase our public health response. And so it's important to incorporate pharmacies into the existing infrastructure so that our strategies are much more robust and enhance the reach to community to identify functional needs populations. You deal with functional needs populations on a daily basis, and it's extremely important there because, quite frankly, emergency management and public health might not see those communities immediately, and that quickly can get lost because and that's a huge problem because those functional needs populations will require the most resources, will require the most assistance in order to provide them following a disaster. And not knowing where those communities exist is a huge gap, and pharmacists can really play a role in providing that information through more coordinated efforts. Okay, so that's the approach. That's what we're hoping to accomplish, and where we see pharmacies playing a very important role. How are we accomplishing that? I wanted to give you a couple examples of some of the strategies that we're actually implementing and some of the practices that we're implementing, just to give you an overview of those and give you a sense of what's out there, and hopefully that will spur or ignite some ideas of how you might be able to coordinate with your communities. So the first one is flu on call. We know for certain that during a severe influenza pandemic, there's going to be a major crisis because there are going to be a large number of people that are ill and seeking care. And we know that emergency departments, clinics, medical offices will be overcrowded because of that surge on medical facilities. And people will have to wait for a long time, if not hours or days, before they'll be able to see a provider and get assistance. As we all know, for an infectious disease outbreak of any sort, time is of essence. And if we're not able to provide the appropriate care in a timely fashion to those affected, then it's going to cost an enormous amount of lives. And so being able to decompress hospitals or healthcare facilities and being able to get individuals to seek their providers much more quickly is of absolute essence, because we do not want to have a repeat of the 1918 Spanish influenza, where we saw up to 100 million people dying from this, because we do have countermeasures in place, but the key to that is time and decompressing those hospitals. So this is the picture that we want to try to avoid, although inevitably we're going to be overwhelmed and hospitals will be packed to the limit. And the key issue there is that most hospitals are already working at capacity or near capacity, so between 80 and 90%. And a mass casualty event for some hospitals in some parts of the country can mean a 2-car accident with 5 to 10 individuals who have been injured, and that could completely stress out in a hospital. So if we're dealing with an influenza pandemic that will affect tens of thousands of people, we already know that the system will be in trouble. And so what we've done is we're working on a system to decompress the hospitals and to be able to provide our communities with a quick response system that keeps them out of the hospital and provides them the appropriate care as quickly as possible. And what we're doing here is we're setting up a nurse triage line to accomplish that. And so this is what Flu on Call represents. And the way it would happen is that a community member will call a toll-free number and then interacts with a voice response system that identifies the location and state of the person calling in, and a 2-on-1 United Way phone specialist who is on duty 24 hours a day. These 2-on-1 centers will be able to answer that individual and give questions and answer any questions. And the piece there that's really important is that 211 specialist is not a healthcare individual, but that person is going to be able to assess quickly if that individual on the phone is just calling for some information that they're feeling, or if they're feeling sick, or if they're treating someone who's sick and they're very worried about the situation, because we know that they will probably not be able to reach a hospital in a timely fashion during an influenza pandemic. And so if they just want some information, the 211 specialist can provide that information or refer them to a public health hotline, website, or community resources in your individual communities. If we do believe that the individual is sick, then the 211 specialist can refer them to a poison control center. And it's important here to understand that we are not in an influenza pandemic where we're dealing with a mass casualty surge. We are trying to reach and support the entire community. And those community members include individuals who have health insurance and those who do not have health insurance. And that's where this question comes in, to ask if they're part of a participating health fund, because that helps us triage the individuals immediately on the local level as effectively as possible. So that when the Poison Control Center triage caller accepts, and those are staffed by healthcare professionals, nurses, pharmacists, doctors, on a 24-hour basis, they can triage the individual and either figure out, do they need to see a provider right away, and recommend to them to go to see their primary care physician instead of going to the emergency room, or if it's so bad that they send them to recommend that they go to the emergency room. In other cases, they might recommend that the individual go directly to a pharmacy to pick up prescriptions for antivirals. And under emergency use authorization, depending on the location, the Poison Control Center staff will be able to prescribe directly, so that the individual is able to go to his or her nearest pharmacy, pick up those antivirals, immediately get treatment, and then follow up with their primary care physician afterwards, all thereby reducing exposure, contagion to other individuals, and unnecessary wait times in the hospital, when we know that through effective and immediate intervention, we could address them as quickly as possible. So the goal here is to improve access to prescriptions of antiviral medications, direct the ill people to appropriate care, and then decompress the hospitals overall. And all with the intent of, as quickly and as efficiently as possible, providing that care to individuals, saving lives, and reducing the continued transmission of the influenza strains that are circulating during that pandemic, so that we can stop this pandemic as quickly as possible. And that's where pharmacists play an enormously important role, because they would be part of the triage system and receiving those patients, being able to support them. And as trusted community members, we expect that the community would come to them and ask them questions as well. So where are we engaged at the moment? Every one of the states that you see here shaded in that teal green, we've engaged and are working with, and they've been part of the Flu on Call site for a while now. We've visited all of the poison control centers here listed in purple. Those are the ones that cover the entire United States, and some of those poison control centers cover multiple states. And then in orange are the 211 United Way centers that we've been also working with in trying to implement the system. And just to let you know, we're going to be implementing a national demonstration project on this Flu on Call system this influenza season. So we do not anticipate or expect an influenza pandemic level this fall by any means. We're expecting a normal flu season, but we have to test the system and get all the kinks out of it. And so we're getting ready to do this in the January February timeframe to see how the system works and where the kinks are, so that we can get those out. So we're really excited about this, and stay tuned about this, because you will definitely hear about this and how pharmacies play an important role in this as well. All right, so continuing on, connecting public health pharmacies. The other piece that you play an important role is supply chain management. We talked about through the Flu on Call system of getting individuals to the pharmacy quickly. to get their antivirals. That also includes vaccines whenever they need it. But it is important to make sure that supply chain is up and at the most accurate level. And so it's important that we understand where the vaccine is and where it's available. And during an influenza pandemic, that might be a problem because the initial release of a vaccine may only include some formulations. It may be delayed because we need to produce the vaccine. And local inventories will be very dynamic with spot shortages all across the country, just based on the need. And so pharmacies play an integral role because as part of that public health infrastructure, vaccine administration should be offered and is offered through pharmacies and other provider offices or health departments, clinics, points of dispensing. But what's unique about pharmacies is the infrastructure already exists. You're already providing vaccines. You're already doing that on a routine basis, and you have the infrastructure in place to be able to support during an influenza pandemic. The key there is to be able to address a surge in individuals. So try to figure out where the gaps and vulnerabilities are in being able to meet the number of individuals that might come seek the vaccinations to you. But similarly, it's important for us to be able to understand where those vaccine shortages are and where the inventories are at a maximum. And that's also true for antivirals. As I had mentioned, it's extremely important to be able to provide rapid treatment to ill persons who have been infected and are sick. And that can be a life-saving decision as to how quickly that happens. And again, those antivirals could be offered in a variety of settings. So we don't want the individuals to overwhelm an emergency department only to get the antivirals when we can put them on it sooner by just going to their pharmacy, which might be, a mile or two away from them versus going to an emergency room, which would maybe farther away, and they're exposing themselves or exposing others to the contagion that they have. And so we need to know, how much inventory there is and what's available so that we can send the people to the right locations and decompress the system as effectively as possible. So what we're trying to do is we're working with pharmacies at the national level and also independent pharmacies to better understand how can we provide accurate inventories to increase coverage, to make sure that all of these systems that we listed here are covered, so that when through Flu on Call or through other systems, we try to prescribe, go here to get your vaccine, go to this pharmacy, or go here to get your antivirals. We know that when they're going there, that they will be able to get what they need, and they don't have to go from another pharmacy to another pharmacy, etc. So on. And so we've partnered with HealthMap, which is a crowdsourcing software for various infectious diseases information, which you will hopefully be aware of at some sort of level, to create Flowmeter Finder. And what Flowmeter Finder does is basically aggregate the information from various pharmacies as to the availability of antivirals. And also it provides information as to what those levels of antivirals are at, and levels of inventory are at the pharmacy. So you can see on the right side that you identify your location by putting in your address or zip code, and identify which antiviral medications you're looking for, how far of a distance or radius that you're looking at. And then what it pops out is basically a map that identifies all of the pharmacies that are available that have all of these antivirals in their current inventory. And so you can see the location, address, directions, website, hours that they are open. And most importantly down here is the list of all of the antivirals that are available, and the colors behind it tell you what the inventory levels are. So red being low inventory, orange being medium range inventory, and green being larger inventory. And we've designated those by the estimated days of availability of those antivirals, considering a certain amount of usage. So that just gives some impression of what might be available, so that if someone looks this up and they say, okay, if I go there now, then I can get this immediately. If I wait too long, I might not be able to get that. So it helps that coordinated effort. The other piece that we're doing is flu vaccine finder. So being able to provide, similar to the antivirals, a concept of where can I find the vaccine, the flu vaccine. And you can see that this is expanded to not just flu, but a number of different viruses, vaccines that are available. So a similar system, it asks you to put in your location, and then you have you identify which vaccines you're looking for, and then it identifies all the locations within that immediate area where those vaccines are available. And so we rely heavily on the pharmacies to be able to provide us an accurate and up-to-date inventory of those resources, so that during an influenza pandemic, we can be very strategic about where we're sending individuals, so the individuals don't have to search all over town to find what they need, but they can come to these websites and use this. And I think that's something very important to point out. You know, we always look at disasters as something that is destructive to infrastructure, provides physical destruction. During a biological incident, we do not expect that to be the case, and so we have resources that we can leverage and use, such as these types of websites, that will be very effective during this type of a disaster, because it will be up and running and we can get this done. But again, we rely heavily on pharmacies to be able to provide that information to us, and we're working with some large chain pharmacies to develop a system of implementing it and reporting on a regular basis. For independent pharmacy chains, we basically have a system right now where you spend a couple of minutes being able to identify what's available and then submitting it to Health Map as a daily report to your system. So it does take a little bit of effort and time, but it's a system that is very robust and is extremely important for the infrastructure in terms of our response. And here you can see the breakdown of the times of how we did this. Okay, so moving on, pharmacies obviously play an important role in their communities, and it's important to make sure that they're connected with the public health community. And so what we've also been doing is looking at the critical infrastructure of pharmacies and the populations that they serve. And so we're mapping out basically strategic level systems to develop decision-making maps and really data-rich maps like these in connection with Health Map to identify where the biggest gaps and vulnerabilities are. So this map represents all the pharmacies within the state of New York by each one is a single white dot, and then all of the counties are shaded in different colors, and that shows you the ratio of pharmacy to the population. So the darker the red, the greater the ratio, the fewer pharmacies there are to serving the population in that county. And so this quickly highlights where there's a need, where there's a population that is heavily reliant on only a few pharmacies. And if you go back to the Baltimore riots, you know, looking at a map like this, and you look at some of the dark areas, if you knock out one of these or two of these pharmacies, it might be well beyond 5 to 10 miles before an individual may be able to reach the nearest pharmacy to reach the medication that they need to treat their current illnesses. And so I just wanted to give you a couple more examples here of how we built this out. This is just Utah, and you can see that there are a lot of areas that are not served by a pharmacy at all. So this helps us inform where the gaps are and where the most vulnerable populations are, if indeed pharmacies are to play an important role in that infrastructure of a public health response. And I just wanted to show you, we're working across the country with many states on creating these types of maps and being able to inform the communities. And this is where we integrate into the entire public health response, because pharmacies help us build that strategic analysis and integrate into the infrastructure in terms of what our plan should be, identify where our vulnerabilities are should a disaster occur, and how pharmacies might be able to fill the gap or might not be able to fill the gap because of those vulnerabilities in the system. Another activity that I wanted to show you is our public health surveillance system with Flute Near You. This is another crowdsourcing system where it's an online health reporting system. And we have pharmacists, healthcare providers, public health individuals report into the system to be able to give us a better situational awareness of what's going on, especially during an infectious disease epidemic or pandemic. It's important to maintain situational awareness and to maintain some kind of reconnaissance about what is going on and what might be impeding or might be coming up soon. Excuse me. And so this system exists. You can go to flutenearyou.org and start reporting into the system, similar to the Health Map system. Although with Health Map, anybody who's interested should reach out to us and we can get that coordinated through a concerted effort. With Flute Near You, you can register on your own and you can get engaged. And what we're doing is we're connecting pharmacy organizations with our partners that help run Flute Near You, and we conduct local exercises with local health departments and pharmacies to determine how these partnerships can use Flute Near You to better inform the community, the public health surveillance of diseases, and make sure that our response is more robust and much more effective. And so this is part of the exercises that we've been doing, but also there have been additional exercises where we've been looking at these partnerships across our community. And so how can you get involved? It's very easy. You just sign up at flutenearyou.org to see how it works. You share information about Flute Near You in your pharmacy and community, and it really is straightforward. Here you can see the mobile version of it that you just report the system into the system, and it logs it right away, and it helps provide that situational awareness. Please feel free to reach out to us or through your local health department to connect to see how we might be able to build the system out. To inform you about influenza-like illness in your community, because that situational piece is important, because it also helps you inform what your inventory should look like to better serve your communities. All right, so the other pieces that I really wanted to touch on quickly as we're going through this is how pharmacies can be able to provide that public health advocacy piece. Which you're already doing to a large extent, but building that out during a response, and again highlighting where pharmacies play an integral role in the response needs, as to making sure that not only our communities understand where they might be able to get the resources, but adhering to the concepts of what they're being provided in terms of the services. So we know mass casualty events will overwhelm the system, and it's important that we understand we cannot reach every individual, or we cannot, follow up with every individual during a mass casualty event. So we need to be able to provide resources and services as effectively as possible. And one of those that is underutilized, but we're getting better at it, is our mobile phones, our cell phones. And so we've engaged in some activities to increase antiviral schedules through mobile texting. We know that 88% of American adults in 2012 owned a mobile phone, and nearly half of those smartphones. And pretty sure that in the past 3 years that has grown significantly from that level. So why not leverage that resource to be able to connect to them, be able to allow us in the public health response and in the pharmacies to focus on our work, and through these types of systems, and still engage with our community to make sure that they understand what the needs are and what they need to focus on. And so what we're doing here is that individuals that are prescribed antivirals, we've developed a voluntary opt-in system where they can come to you and, they receive the information sheet, excuse me, and receive the information sheet, and then are told, what the antiviral schedule is, and they need to maintain that adherence. We built out this mobile system to increase that awareness, and basically what happens is that the individuals opt into the system and they get regular reminders to make sure that they maintain that adherence, and we can increase antiviral medication adherence level schedules through the system. So at the pharmacy, you don't have to worry about that, or healthcare providers, we don't have to worry that they're going to stop it and then have a setback in illness if they don't follow through with the system. And similarly, we're doing that with our vaccinations. We know, pharmacies are continually increasing their vaccination administrations throughout the country, and they're becoming an enormously important role in providing vaccines to our communities. So during an influenza pandemic, we might anticipate that they might require 2 doses of a vaccine. And so we've developed a system to provide a reminder to individuals so that they can come back and get that second dose and be effectively protected from the influenza strain. We do know that there are other parts of the country, like New York, that are rolling out a similar system for hepatitis vaccination reminders, where we require 2 doses, and other systems are looking for HPV reminders as well. So leveraging that system at the pharmacies, we're testing actively best practices. So in this case, we've developed a system again through mobile texting of a reminder system in the case of an influenza pandemic that people can voluntarily opt in their communities after they come to a pharmacy to get their vaccine. And then through mobile texting, it reminds them after 21 days that they need to go back and get their second dose of the vaccine to ensure complete coverage. And throughout that time, the mobile messaging system provides public health information about where to go if there are any adverse effects experienced, or if they still feel sick and they need to see someone, or what are basic hygiene or personal protective measures that an individual can take to protect themselves from getting exposed to influenza. So a number of strategies that you can see here that we've implemented through mobile texting reminders to do the system, and we're implementing these. We're not only talking about them, we're testing them on a regular basis. So this is an example of where we had an exercise at a pharmacy to address a mass surge event to see what are sort of the vulnerabilities, issues, and challenges surrounding a surge on a pharmacy. How quickly can they get through vaccinations? What is the maximum level of vaccinations? And how would these mobile texting systems or other strategies be most effective? So this is just some pictures to show you that we're actually implementing and testing them so that they're ready to go into the community. And these are tools that we're providing our communities to where no additional resources need to be invested, because these are tools that are available to the community, assuming that they implement them, and that requires a whole community approach. And pharmacies need to be at the table with their public health, emergency management, and government officials to understand that pharmacies are part of that infrastructure during response and play a very important role in that. Last thing I wanted to show you in terms of the value of what and where pharmacies play in. This is obviously very recognizable to everyone, hopefully an urban population growth map of Milwaukee, Wisconsin. And when you look at this again, similar to the map that I showed you in Baltimore, this identifies the population density across the city and where those areas are. And what we're doing through our mapping system, through our GIS mapping, is identifying how pharmacies or other community partners can play an important role in meeting those gaps in issues and challenges. And so here you can see the distribution of pharmacies over hospitals throughout the city of Milwaukee. And just to highlight this a little bit more, as you're well aware, Milwaukee has about a population of 1.4 million individuals, shown here by population density. Each circle represents a certain population density within the city itself. Not very meaningful in itself, but when you look at what the coverage of hospitals in a 2-mile radius around the population, you can see that those hospitals cover about 827,000 people in a 2-mile radius that they can immediately serve or would be serving directly, assuming no other direct mode of transportation. But look at the coverage when we talk about pharmacies. The pharmacies almost cover the entire population of the community, and it's here really where that resource and existing infrastructure is absolutely essential to help out. And so that's the point that we're really trying to make, is that whole community approach has an enormous impact, because we know everybody's suffering from resources and lack of staffing. If we can leverage the existing infrastructure, we can be much more effective given those constrained resources. One last thing that I had been asked to talk about that I would just like to quickly present is the action planning on increasing HPV vaccination rates. So NACCHO is actively working in conducting action planning with 10 local health departments to plan for increasing these vaccination rates, and the key objectives there are to directly fund and support 10 local health departments and provide technical assistance through webinars and conference calls, and as well as our HPV project advisory board. And the goal here is to develop a statement on how we can best increase vaccination rates in both females and males. And ultimately, we'll be able to provide a resource that will be available to everybody across the country on best practices and lessons learned and recommendations and guidance as to how that might be implemented in individual communities. So just to identify the local health departments that have been funded currently, the request for an application was released last November, there were some ideas and goals to identify local health departments that serve at least 150,000 persons to participate in the action planning process as a whole in identifying those best practices. And so what the action plan is really going to focus on is reinforcing the message of HPV vaccination and how it prevents cancer, and looking at ways of working with schools to improve education about access to the HPV vaccine, engaging partners as champions and identifying who those partnerships might be, increasing access to the HPV vaccine at a number of different levels, and identifying opportunities to improve that data. So be on the lookout for that as each local health department develops their unique community plans. We're hoping to collect shared numbers of themes that we can do under these buckets to provide a valuable resource for the community, and how we can clarify and reinforce the message for the HPV vaccine to protect our community members. And with that, just my last slide. Thank you for your attention. I really appreciate it. Please do not hesitate to reach out to me. My contact information is listed here. I'm available to support your efforts. That's my mission. We work with our community members and try to foster and ignite and really be a catalyst in these activities. I hope that I've shown you how pharmacies play an essential role in those activities, and where and how that role can be integrated in the public health response. We're actively working with our communities and their partners. So thank you very much for your time, and I'll pass it back over to Randy.
All right. Well, thank you, Dr. Rose, for outlining the important role pharmacy professionals have in working with public health partners.
And we just want to let you know that PSW appreciates your support and for working with us to prepare this educational program. So as another reminder, in order to receive CE credit for this webinar, you must claim CE credit on the course webpage by completing the self-assessment and program evaluation. Please contact the PSW office with any questions you have.